we have to consider that there's a lot of potentiality in front of us, and one of the rising potentiality is immunotherapy, right? You can do several things with immunotherapy. One of them is well known. It's about checkpoint inhibitor. That's a trigger point that activates your immune system. And you have some other modalities like CAR-T, but also bispecific, which are binding the T lymphocyte. So the T lymphocyte is basically the cell that will destroy the cancer cell. And in this case, we harness our own immune system, so our own potency to battle against infection or malignant cells, right? And here, with bispecific antibodies, we basically bring the T cell close to the cancer cell, that this T cell will destroy the cancer cells. So actually, we are developing a compound which is called teclistamab that has also data being released in ASCO, and that shows also a very potent efficacy with quite reduced side effect, in this case, cytokine release syndrome, because this is the pattern of using lymphocyte as such. And this balance between a very good efficacy and a very manageable safety profile makes this type of compound extremely interesting for the future of multiple myeloma treatment. When we say antibodies, we are basically mentioning very different modalities, in fact, right? With antibodies, you can basically act on the receptor on the cell, and by acting on this receptor, you have a cascade of consequences into the cells, okay, that can induce the death of the cell. With antibody, you can bind some substance on the antibody that will therefore get into the cell and also destroy the malignant cells. With antibody, you can bring a T cell, a T lymphocyte close to a cancer cells that this T lymphocyte will destroy the cell. So you see that you have many antibodies, but they are not doing the same thing. Really, in this case, when we are mentioning teclistamab or JNJ-4528, it's really about engaging the lymphocyte T with the cancer cells in order to destroy the cancer cells. And what we have to get in mind is that the potency of a T lymphocyte is extremely high, right? So it's extremely potent. The other thing is that even within those modalities, you have some difference. So which means that all the CAR-T are not the same. And the CAR-T can act in a different way, meaning they can have different target, but also in the way they are constructed, they can also have a different profile of efficacy or of safety. And with JNJ-4528, we have indeed a unique construct where the receptor on the T cells have two binding sites to the cancer cells, which make it pretty unique. So antibodies, it's a large family, but with very, very different way of acting. Yeah, that's an important question. We think as Janssen that there are three pillars that will definitely make this landscape evolve. The first one is cancer interception. So we believe that intervening as early as possible in a disease, and especially in malignancy like multiple myeloma, carry the potentiality to intercept the disease, so to avoid that the disease will develop to a severe stage. So that's a concept that we are basically running, and that's why I told you that moving earlier in the line is extremely important, because the earlier you go, the more you have a chance to intercept and control disease. That's one thing. However, we have the ambition to reach a cure one day in multiple myeloma. And we made great advance in that disease. Within 20 years. So if we look at all the progress that we have made in 20 years, we can imagine that the years, in front of us can lead us to the cure and the potentiality of a cure for many patients, right? And the third point, the third pillar is treatment individualization. When you have a lot of therapeutic options, when you are able to understand a lot of the pattern of the genetic of the patient, not all patients are responding the same to treatment, and there are underlying reasons for that. So the more you will know what are these individual factors and how important they are to the therapy, the more you will be able to achieve a great outcome for patients. So we think that the more we will be able to individualize the treatment, the better outcome we will reach, not only on efficacy, but also in treatment satisfaction for the patient, okay, in terms of quality of life for them.